How many have had really solid deep tissue massages and you're just crying on the table around the shoulder? Guess what? They're in. They're in that thing, all right? That's where you're gonna feel most profoundly. Because you don't realize how much you use your rotator cuff every day in life and how much it supports and stabilizes, and then someone doing some soft tissue self-care on you, and it doesn't feel very Swedish massage, does it? All right, here are the jobs. Shoulder abduction, supraspinatus, external rotation by the infra. Subscapularis does internal rotation to return the forearm to the body, and then the teres minor does internal rotation as well. I'm sorry, excuse me, that should be external rotation, that's a typo. That should be external with your infraspinatus, all right? Now, we can do these motions in many different angles. Here right now I'm in shoulder flexion. What was that? Internal, right? I don't want to get too far ahead of myself because we'll all do the motions together, right? We have external rotation. Guess what? Internal, external, internal, external. So it can come in many different formats, all right? During arm movements, the rotator cuff muscles, sliding and excessive movement of the humeral head to allow full range of motion and stability, all right? There you go. Major muscle movers, so we have stabilizers and then we have primal movers of the shoulder. We have our pectorals, which provides protraction of the shoulder blade. So now my two shoulder blades are separating from each other, and then they provide horizontal adduction of the arm. So when we do your classic chest press or push-up, that is protraction. When we do chest flies, that is horizontal adduction. The deltoids provide flexion, they provide abduction, and they provide extension of the shoulder. All right? The rhomboids and trapezius, retraction of the shoulder blades. What we'll talk about as the end principles of shoulder care, it's all about healthy joint mobility of the scapulothoracic joint. We'll talk about soft tissue self-care, and we'll talk about really focusing on retraction and depression. Okay, that's the key. The latissimus dorsi does depression and adduction of the shoulder blade, pulls down and brings together. Your biceps provide flexion of the shoulder. Did you know that your bicep has 3 jobs? What are all 3 jobs of the bicep? What's the obvious one? Elbow flexion, shoulder flexion, all right? So right now, if I manual resist my friend right here, okay, and I say, hold your arm up, don't let me push you down. Nope, palm up, it's fine. Good, go ahead and press, press, press. Can you feel your bicep tendon?
Oh, yeah.
Get tension? There you go, perfect example. Manual muscle test over forearm and flexion, bicep tightened up, all right? And then it also does supination. Check this out. I don't know exactly have a very big arm, but supination of the forearm. 3 jobs. Triceps, extension of the shoulder and extension of the elbow. All right. All these are originating in the area of the shoulder joint. Here's your posterior view of all these muscles. What motions can the shoulder do? Let's perform them together, team. All right. Okay. Are you guys okay with standing up? Cool. You can stay in your stations, your quarter. All right. Isn't it amazing how many motions we can get from the shoulder? The beautifully complex shoulder, right? Okay. Can someone show me an example of scapular depression? All right. How about if I give you elevation? Is that scapular elevation? Yep. And then how about this? Depression. Elevation. Depression. Elevation. Okay? So you want to talk about primal healthy movements? Can you even scapulally depress? You must elevate to be able to depress. So this all comes from, not necessarily from here, but because my shoulder blades are elevated, and then we pull down. All right? That's something you want to work on. Isn't it so empowering? We can say that a small percentage of women can do 1 chin-up, correct? That shouldn't be. So what would be gateway number 1 if you're hanging on a bar or working on a 45-degree angle with TRX? Can you show me scapular retraction and scapular depression before we worry about lifting ourselves up? We have to think of the gateway 1A. So effective scapular depression would be that. How about scapular protraction? Let's go ahead and bring our arms out in front of us, okay? Can you show me protraction of the shoulder blade? Go forward, and then retraction. So we have protraction, retraction. Just gonna hammer home the importance of shoulder blade glide. So we have our vertical, correct? And then we have our horizontal. So different angles of the shoulder blade. Depression, elevation, protraction, and retraction. Can you show me shoulder flexion, everybody? Or how high can we go? Pretty large degree. Oh, frozen shoulder? See? That's why you're here, isn't it? Can you show that? Are you okay to show that again, please?
Yeah.
All right, go ahead. All right, so it's okay. So go ahead and give me your left arm. All right, solid right here, right? 160, 170 degrees, correct? Coming down from the hip line, and now we're going to go here, All right, Jennifer's going to go and show me up. Keep going as high as you can go. Now, she's trying to go higher, but is it a false positive? Is it coming from somewhere else? So when you do that, what do you feel?
My shoulder elevating.
Okay, so you feel a shrug as opposed to elevating. So if you'd have healthy flexion, isn't it amazing how you still have to go down? See that? You have to make space in that joint to allow for that. Yours doesn't. It stays stuck. Your capsule is stuck. It's not going down to allow the hand to go up. So we start seeing this going on. So we have a false positive. So what do you feel? Do you feel discomfort at all? Or just stuck?
A little discomfort.
Okay, so we have pain involved, all right? And pain is a signal, is it not? All right. Thank you for showing that. Appreciate that. So we have flexion, and if we have a yin, we have the yang. So if we have about 160 degrees of flexion, how far back do you think we have starting from 0 in extension? What would you say that would be? 40, 45 degrees maybe if you're pretty mobile. And that would have to once again allow your humeral head to go down. So we have flexion and extension. We have abduction, correct? So we can go chicken wing or we can go full arms, can't we? All right, palms open in external rotation. We can go high. Once again, a large degree of shoulder abduction. And of course, the yang to that would be adduction. So if I want to reduce any probability or chance of impingement, do I want to focus more on abduction or adduction? Adduction, right? To add. What do we want to do when it comes to aesthetics? Abduction all day, right? Man, I want those deltoid caps. I want that V taper the guys are thinking, right? Exactly. I want that sexy back. So ladies, we're very abduction minded, but how many of you actually have taken a cable and just done this and brought your hand back to your body with cable? We're all about doing this away, all right? Good for you if you are. So we have a domination of one motion without the complement of the other motion, correct? We have horizontal adduction. So let's say we're here in the letter T. We are adding to the body, coming to the midline. And then, of course, we have abduction to take away, all right? Your classic chest fly or your rear delt fly. Then we have external rotation. Let's go over all the ways we can do internal and external rotation. With our hands by your side. How about this? I'm rotating as far as I can. Now I'm externally rotating. Now, if you think about it, instead of just thinking myopically to just the shoulder, what if I said, I'm going to go as far as I can, and I'm going to provide a hollowing or rounding of my back, and then I now want to fully externally rotate, I'm going to adduct to bring my shoulder blades together and do that. So when you think of the greater good, instead of just isolating, how can you integrate to maximize internal and external rotation? Let's go here in flexion, all right? So if my hands are neutral, internal rotation is going into pronated palms, correct? And then now, if we want to do external rotation, we're holding a bowl of soup, we're supinating, and we're doing that. If we're to the side, we are now once again rotating forearms and humerus in, and then if we're externally rotating, I'm going to externally rotate, and I'm going to try and depress at the same time. How many of you ever thought about doing that? So maybe just even focusing on some of these motions might help your range of motion. So as I externally rotate, I'm now pulling down and in. If I flex my elbows to 90 degrees, we have full internal rotation coming in, and then we have full external rotation coming out. So there are many ways to experience internal and external rotation. Try not to be confused just because your elbow is bent or your elbow is straight. All right? Any questions on that? Are there any motions I missed there? No? Scapular elevation, depression, protraction, retraction, flexion, extension, AB and adduction, horizontal AB, AD, internal, external rotation, and then all of those different degrees of the elbow. All right. If you like to sit down, you can, if you like. Right? Common soft tissue injuries of the shoulder. Look at that. That's a nice drawing there, but that's really what happens. Supraspinatus tendon tear. So we talk about how injuries can occur. If we go back to our bony anatomy, if I can still work here, good, right? So we have our, let's take a look. All right. So we have our clavicle, correct? We have our acromion process, all right? Clavicle, acromion process. We have a car hood, all right? Here's the hood of the car, all right? We have the head of our arm bone. Here's the engine. Sitting in between that space is a rotator cuff that wants to move, that wants to play. But if we have a tight capsule or we have poor mobility in the shoulder, guess what? The space between that engine and the car hood is diminished, correct? And if we have a tendon of a muscle sitting in there, and that muscle is doing this repetitively, or spending a lot of time in throwing an overhead activity, doing barbell snatches, doing dumbbell snatches, all we're doing is making this happen. Or we have the tendon that's operating as I'm abducting my shoulder, and now we have diminished space under the car hood and the engine, and then we have friction on that supraspinatus tendon. And friction usually leads to what? Heat. And heat is inflammation. So now we have a swollen tendon that is now being chafed under the car hood. Am I making kindergarten sense here?
Yes.
Repetitive inflammation over time is not simply tendonitis, it leads to that. Rip. All right? So the more you take that tendon and you cheese grate that thing under the car hood, the more you're simply affecting it, leading to tendonitis, leading to inflammation, chronically leading into a tear. We would never want to get to something like that. All right? It's a beautifully horrible drawing right there. All right? We never want that. So we can experience rotator cuff impingement and tears. We can experience bicep tendonitis and then even labral tears. Let's get into them more. So I just once again reiterate. Okay? Car hood, car engine, tendon runs under that, friction, all that goes on. Okay, biceps tendonitis is generally a micro trauma over high volume of repetitive motions loading over time that lead to friction and irritation of the bicep tendon within its groove. Same thing, just like the rotator cuff. So we have a little groove. You can even feel it. You guys ever want to feel your own bicipital groove? All right? You just start playing a little bit. Sometimes it takes a little internal and external rotation to find out where that groove is. So we have a tunnel in which the tendon of your bicep tendon sits, and with repetitive motion, lifting overhead, that can also get swollen. And if the tunnel space is only so much, now it's pushing into the bony anchors of that groove, and then we have inflammation there. All right? Modalities of ice, heat, ultrasound, laser can help quiet symptoms. The profound impact of heat and ice are immense. Simple modalities that everyone has resources to at home, right? Heat and ice can really help take care of tendonitis. Eccentric exercises for much of the body can lead to help strengthening tendons and the overall integrity of your muscle as well, okay? So think about doing the eccentrics. We understand here in this room, hopefully, concentric, isometric, and eccentric, okay? Isometrics might be the first gateway, and then getting into the negative overload can help prevent any chance of microtrauma. Whether it's tennis elbow, whether it's little league elbow, golfer's elbow, generally this microtrauma happens over time because we didn't prepare the integrity of that area, despite us playing golf, baseball, swinging sports, right? Lifting weights. Rotator cuff impingement and tears. Impingement is when the rotator cuff tendon, most often your supraspinatus, begins to consistently rub or chafe under the acromion process. Here you go. Car hood, car engine going through. It begins to get swollen. That's the red in the picture. All right? That puffy tendon now is impinged. Over time, tendon fibers continue to fray, so you have this fraying, the cheese grating effect, until a tear of the muscle itself occurs. How does this happen? Lack of depression or downward pull of your humeral head. So remember we talked about scapular depression? Essential, scapular retraction. So we can essentially take the engine and pull it down to create more space for that tendon to run under the car hood. You can consciously manipulate that in a good way. And we'll do those movements at the end or towards the end here of our course. All right? So lack of depression, spending more time in elevation in a tight capsule will lead to the chafing and rubbing over time. All right? Here's another example of that. Car hood, engine, chafing. Labrum tears. Oh, this is the tricky one right here. All right? Your labrum is a ring of cartilaginous tissue. It is avascular. What does that mean, someone? No blood supply. That which doesn't have blood supply generally cannot heal on its own, correct? We need blood with nutrients to heal things. If no blood gets to an area, how does it heal itself? Okay? So it helps deepen the socket. So if only 25% of my humeral head is sitting within the glenoid fossa, that labrum may give you like an extra 10%. It is very sensitive, all right? The ring of cartilage that deepens the socket of the joint, the labrum, can experience a tear from a microtrauma incident. Has anybody torn a labrum here? Okay. Was it a macrotrauma event? Okay, there you go. All right, collision. Guy gets tackled, lands on his shoulders. Soccer, basketball, all right? Dwayne Wade he was dribbling a basketball against the Houston Rockets like 12 years ago, and some guy had his arm, caught Dwayne Wade's arm, caught at the wrong angle. Instantly, he went like this, into the chair, into a wheelchair. How many times have you ever seen a basketball player get wheelchaired off the sideline for a shoulder injury? Talk about instant pain, all right? It is uncomfortable. There you go. That's what it looks like under a scope. All right? So when we talk about slap lesion is the most common type of labral tear, superior, lateral, anterior, posterior. So if we think the hands of a clock, 12 o'clock, 1, 2, 3, 4, it basically tells you that a slap lesion is the most common one. It happens superior and anterior on the ring of that clock. Okay? Generally occurs from collision, contact, or dislocation. Many times causes this injury. Okay? Increased pain will with even small amounts can occur. It's not comfortable. All right? Is this something you can live with? It is. You can still try to dynamically support with rotator cuff strengthening exercises the overall integrity. It's based upon a case-by-case basis if it's needed to be repaired. If you want to continue in your activity, perhaps that might be an idea, but it is something that is livable. But if things like deep chest press, bench press give you discomfort, guess what? That is no longer in your arsenal of chest exercises. All right? So you can live without it, right? Without repair, it's okay. Just depends on your personal quality and need for life. Look at that. Wow. Do you think these things were natural when God made us? All right? Look at that degree of external rotation. Look at the forces on his elbow ligaments, on his shoulder. That is incredible. And then the follow-through. So the reason why I put the follow-through picture is because when we throw, we're here, sorry, I'm left-handed. When we throw, something has to decelerate that arm. And that's what the rotator cuff, the posterior sling will do. All right? The rhomboids, the lats, the trapezius. So when I used to play a full tournament of beach volleyball, the posterior capsule, posterior area of my shoulder was the sorest thing in my body. But Paul, you jumped 350 times. Weren't your quads or your glutes or your calves sore? No, it was this. Due to the sheer violence of the eccentrics of me swinging a volleyball. Not the force coming forward, it was on me having to hit the brakes in the backside. That was always the sorest thing over a full weekend of playing volleyball. Right there. Because of this follow through. Look how far across, horizontally adducted, his right arm is to his body, to the left side. All right? I can't imagine how we could possibly hurt our shoulders. Couldn't think of it. Oh man. Aaron Rodgers, some cool tennis player. I mean, look at what we take and put our body through, our shoulders. The amount of force we develop with exercise physiology and research through our lower half, transferring that weight to our core, developing the obliques and the spine, and then with Olympic lifting and barbell lifting, and then this little shoulder says, what about me? All right, it's the victim. Take a look at that. Woo, okay? There you go, look at the degree of she's in serious rotation right here. Look at this. We now have 95 pounds above her head, all right? And now we have that, the momentum in doing a snatch. So we're here, snatch, we then hip extend, we come up, and that barbell doesn't want to just go up, it wants to go where? Back. Guess what? Instant slowdown, instant deceleration. All right? So I'm very much a clean guy as opposed to a snatch guy. All depends on your personal history, but it is more challenging. Why can we do more weight with the clean than we can a snatch? Limiting factor is the lever length and the physics. So the physics load on your shoulder is greater with a snatch than it is on your clean. All right? Clean would be here, elevate, flip. This is whoop, slow it down. All right? Impressive snatch pattern, very good. Okay? But you can see why we can hurt ourselves. So how do we prevent or reduce the likelihood of shoulder injury? How about something as simple starting with a postural assessment? Okay? Assessment is a good starting point. But remember, we are personal trainers, not physical therapists. All right? Know your lane, sis and bro. But you can still do a preliminary observation of someone. So something called the plumb line. If I had hanging down from this beautiful light a string, and I stood next to the string, how is my ear in relation to my shoulder? Do I have forward protraction? Could we say that cervically, if I begin to go this way, then everything else begins to follow and cascade through, which diminishes my space for my rotator cuff to work? All right? How is my shoulder in relation to my hip or my ankle? All right? Is there a difference of level of one shoulder to the other? Am I riding high, riding low? Is there excessive internal rotation organically? Do I walk around like this? Hi, nice to meet you. How are you? Thanks for coming to my lecture today. Sign. Right? How about protracted back or hollow chest? You know, you may have the greatest chest, but then we have all these weak decelerated muscles eccentrically, and now we're sitting like this, and now my humeral head is now way ahead of the rest of the body. So little things to look for as a fit pro is just assessing someone's posture, right? You can use a simple plumb line coming from the ceiling. You can just observe visually and use simple logic. How about range of motion observations? Full ranges for any movements, or are they limited? So we just witnessed limited range of motion, did we not? Yeah. Would you say now with your limited range of motion that there is, do you feel there's a level of atrophy with your muscles? Do you notice any significant deficiencies of strength in lifting things? Putting luggage in the overhead compartment of an airplane, suitcases,
Oh, yeah.
backpack? So due to lack of range of motion, what do we have? Lack of muscle use, right? So it's not getting love because it's not getting exposed in the areas that they want to work. So there are many muscle tests you can do with someone. Would anybody like to be a volunteer? Anybody volunteer? You know, oh, I called you up, brother. Only because you reached out to me in my morning class. Good to see you again. All right. So manual muscle test. You can do comparison from side to side. You okay?
I'm great.
All right. You nervous? I've been nervous since we started this whole thing. It's okay. All good. All right. So manual muscle test. Biceps, triceps. Very easy, correct? All right. So I'm going to go palm up. Put your elbows at 90 degrees. I'm trying to measure for simple isometrics. Okay? Go ahead and hold it up. Don't let me push you down. So generally at 90 degrees of joints is where you have the greatest mechanical load on muscle. All right? Squat here, elbows here, shoulders here. Okay? So I have that. But then I can also put them in a shortened muscle position. Keep your arm in. Don't let me pull you away. Notice I'm anchoring myself to him. Very good. And of course I can put him down at a lower position as well. Hold that. Don't let me push you up. Very good. Excellent. So now I would compare bilaterally. So if somebody's saying, you know, Paul, I have this shoulders kind of bother me a little bit. You know, it's been about a week and a half. We've been doing some upper body stuff. And, you know, I go out there and I play pickleball. Right? We're playing a lot of pickleball lately and, man, my shoulder's bothering me. Okay, let me take a look. Range of motion tests, right? So I would say, open up your palms. Can you bring both arms above your head as high as you can? Okay. Come on back down. Do that one more time for me, please. One more time. Very nice. Come on down. Good. Arms by your side. All right. Go ahead and raise your arms forward as high as you can. Very nice. Just simply doing active range of motion test. Outstanding. How far back can you take your shoulders? Very good. Come back. All right. Bend your elbows at 90 degrees. Okay. Go ahead and give me external rotation of each at the same time. Very good. But keep your elbows by your side. And then now as you're bringing them in, go ahead and give me just your right arm into your body. Come back. And then come back out. Left arm in your body. Very good. Can you bring your elbows to 90 degrees to the side? Very good. Hold them up. Don't let me push you down. Very nice. So I got an instant bilateral comparison. 5 out of 5, 4 out of 5. They're great. Hold them up. Good. Now go ahead and try to bring them back down to your body. Very nice. Keep that fist. All right. Try to bring your hand in towards your navel, please. Very good. Keep it there at your navel. Don't let me pull you out. Keep it at your navel. Thank you, sir. Very good. Go ahead and push your arm out against me now. Any pain or discomfort experience with that? All right, good. You don't have to act.
Not
It's
yet.
okay. All right, not yet, exactly. All right. So you do the same thing for the other side. I would do what's called the speed test. Palms up. Hold it up. Don't let me push you down. Once again, I'm challenging that. I would also do what we call an empty can beer test. So as if you're holding an empty can, this is your prime one right here. If you want to measure someone's impingement, if they're lighting up, turn your thumb down like you're holding an empty can. Good, don't let me push you down. All right? Somebody who has a level of impingement or discomfort in the rotator cuff, supraspinatus, will instantly, man, you'll light them up quickly with the empty beer can test. So you would take someone through a battery manual muscle test as a simple fit pro within your arsenal of skill sets, just to see if there's any deficiencies in strength, and then you test the range of motion. Nothing wrong with that. Based upon your impression, not your diagnosis, you might be able to refer if you have a colleague or network of people, such as physical therapists or orthopedic doctors. Thanks for being a good sport.
Thank you.
Appreciate it. You couldn't sit down quick enough, right? Cool. So there's nothing wrong with just doing bilateral